This painful bend in the penis can develop slowly and make normal function uncomfortable, but doctors are now testing a treatment that doesn't involve any cuts or surgery. Peyronie's disease happens when scar tissue builds up under the skin, causing curvature and pain. Instead of operating, doctors use shockwave therapy. First, the area is carefully examined, then a small device is placed on the skin over the affected spot. No needles, no incisions. But here's the real magic. The device sends low-intensity sound waves into the tissue. These waves do not break anything. They help improve blood flow and may slowly soften the scar tissue over time. Sessions are short, and most people return to normal activity right after. Pain often improves, but the curve may not fully go away in every case. So while it is a safer option, it is not a complete fix for everyone. Would you consider trying this treatment if you needed it? They literally remove your damaged hip joint and replace it with metal so you can walk without pain again. When the hip joint becomes severely worn out, even simple movements like standing or walking can become unbearable. During hip replacement surgery, the patient is first placed under anesthesia, so no pain is felt. Surgeons then make a precise opening on the side of the hip and gently move the muscles aside to expose the damaged joint underneath. The worn-out ball at the top of the thigh bone is carefully removed using specialized surgical tools. But here's the part most people don't expect. The inside of the hip socket is reshaped and fitted with a strong artificial cup designed to move smoothly for years. A metal stem is then inserted into the thigh bone with a smooth new ball attached on top, creating a completely new joint. Once everything is aligned perfectly, the joint is reconnected and tested for movement. This surgery helps many patients walk easier, move freely, and finally live without constant pain again. Would you consider this surgery if you ever needed it? What if your bladder or uterus slowly started slipping downward inside your body without you even realizing it? Pelvic organ prolapse happens when the muscles supporting the pelvic organs become too weak, causing pressure, pain, and bladder problems that can seriously affect daily life. When exercises no longer help, doctors may perform a special surgery to lift everything back into place. The patient is first given anesthesia, so no pain is felt during the procedure. Surgeons then use tiny surgical tools through the vagina or small abdominal openings to reach the weakened area. But here's the part most people don't expect. The dropped organs are carefully lifted upward, and the stretched tissues are tightened to support them again. In some cases, doctors also use special mesh or the patient's own tissue to make the repair stronger and more secure. The procedure is designed to reduce discomfort, improve bladder control, and help patients return to normal life with confidence. Recovery is usually smooth with proper rest and avoiding heavy lifting for a few weeks. Would you consider this treatment if you ever needed it? Doctors are now fixing this condition without cutting your skin wide open. A torn Achilles tendon can happen in seconds during a jump, sprint, or sudden movement, and many people instantly lose the ability to properly walk or push off their foot. The Achilles tendon is the powerful cord connecting your calf muscles to your heel, making every step possible. During the repair procedure, the patient is placed under anesthesia, so no pain is felt. Surgeons then make a very small opening near the back of the ankle to reach the torn tendon. Special surgical tools carefully pass strong stitches through both torn ends of the tendon to secure them tightly. But here's the real magic. The sutures are pulled together in a locking pattern that reconnects the torn tendon and restores its natural strength and tension. This closes the gap and helps the tendon heal in the correct position. The foot is then protected in a boot while recovery begins. With proper healing and therapy, many patients return to walking, running, and even sports again. Would you try this treatment if you ever suffered this injury?